This is Melissa Mounts. I'm going to do my secondary assessment. I'm going to do BSI Scene Safe. I'm going to check my scene safety. I'm going to see if there's any hazards, if there's any weapons. I'm going to see if it's day or night, if there's any hostiles, bystanders. I'm going to check for MOI, NOI. I'm going to check number of patients, additional resources, consider spine stabilization. I'm going to see how the patient is. Do they look sick, not sick? I'm going to see if their level of consciousness, AFPU, alert ×4. I'm going to see what their chief complaint is. Their airway, breathing, circulation, disabilities. I'm going to expose them, check their chest, and see if they need to be transported immediately. I'm also going to check Perla, see how their eyes look. I'm going to go down, and if they go ahead and do their secondary assessment, OPQRST. Did it come on gradually? What makes it better or worse? Describe your pain to me. Can you point to it? On a scale of 1 to 10, 1 being nothing, 10 being the worst pain you ever felt. Usually I ask them, is a 10 being a bear's eating your face off? Treatment. Have you taken anything? Does it make it worse? What's your signs and symptoms? When's the last time you ate? Do you take any medications? Are you allergic to anything? Have you had any surgeries? Does anything you take, when and what made it worse? Is it anything that you did that made it and brought it on? We're also going to do the HER. Habits. Do you smoke? Do you drink? Do you use tobacco of any kind? We're going to look around at their environment. Is there anything laying around that could cause it to be worse? Risk factors that could have brought this on. We're also going to kind of look at their chest. We're going to go ahead and hook them up to the monitor, take their blood pressure if we haven't already done that, check their blood sugar. We're going to, if they need it, we're going to have them on an IV, 12 or 18 or 20 gauge. We're also going to have them on O2 at this time if they need it. We're going to check for JVD. We're going to listen to their lung sounds starting on their right. We're also going to check for heart tones. We're going to go down and look at their PMS and ROM on their upper and lower extremities. We're going to see if they have good pulses. We're going to make sure their skin and skin appearance. We're going to make sure there's nothing else going on, no life threats. And then we're going to go ahead and call in our report. At this time if we had to stay and play, we'll go ahead and transport, or we'll be in transport. We will have our, make sure that we have called in our report, and we should be arriving at the hospital at this time. And that'll be it.